The symptoms of Alzheimer's disease can initially go unnoticed for years.
Yes, but now experts are hoping to make it easier for doctors to diagnose the illness early, which then may save lives. CBS 2's Dr. Holly Phillips joins us to explain this.
Sure. Well, Christine, doctors actually want to be able to diagnose Alzheimer's disease before patients become forgetful and confused. And we know researchers believe some Alzheimer's drugs fail because they're given to people whose illnesses are already too advanced to do any good. But now some new recommendations may help make early diagnosis easier. For the first time in more than 25 years, experts are proposing new guidelines to diagnose Alzheimer's disease.
It's a major advance for the field.
Right now, the disease is diagnosed only when the memory starts fading and dementia takes hold. Researchers believe it can be detected much earlier.
We now are realizing that what we call Alzheimer's disease may start decades before a person actually comes to a doctor's office with memory problems.
A combination of 3 tests would be used to catch the disease early. PET scans to spot changes in brain function, blood tests to detect genes that increase risk, and spinal fluid tests to find signs of plaque buildup in the brain. There are no current treatments to reverse Alzheimer's. Spotting patients early would allow researchers to test new drugs and possibly lead to new treatments. But early diagnosis also comes at a price.
Many of these tests are expensive, and we would be expanding the potential patient population.
The guidelines still need to be tested, so widespread use could be some years away. The National Institute on Aging estimates more than 5 million Americans already have Alzheimer's, but researchers believe the new guidelines could find 5 to 10 million more who may be developing the disease but are not yet showing symptoms.
So at what age really should people be screened for Alzheimer's?
Well, Christine, it's very rare for people to actually develop Alzheimer's disease before the age of 65. So for most people, you can really catch that umbrella of people who are going to get the disease if you screen them then. But people who have a family history or who are starting symptoms may need to be screened earlier. It's actually considered early onset Alzheimer's if it happens before 65.
So important to talk to your relatives about these issues.
Very much so. Family history really does direct what's going to happen as we age.
Dr. Holly Phillips, thank you very much.
Thanks, Doc.